Assalamu alaikum warahmatullahi wabarakatuh. Classification of RCT. On the basis of study designs, this classification is more descriptive in terms of how patients are randomized to treatment. On the basis of hypothesis, on the basis of outcome of interest, purpose of study, phases of study. On the basis of study designs, placebo group. Each participant is randomly assigned to a group and all the participants in the group receive or do not receive an intervention. Crossover. Over time, each participant receives or does not receive an intervention in a random sequence. Cluster. Pre-existing groups of participants, villages, schools are randomly selected to receive or not receive an intervention. Factorial. Each participant is randomly assigned to a group that receives a particular combination of intervention or non-interventions. Group 1 receives vitamin X and vitamin Y. Group 2 receives vitamin X and placebo Y. Group 3 receives placebo X and vitamin Y. Group 4 receives placebo X and placebo Y. Current parallel study designs. Defined populations. Randomized new treatment, chronic treatment. Patients are randomized into two groups. The new treatment or to the standard treatment are followed up to determine the effects of each treatment in parallel groups. Treatment groups improved, not improved. Current treatment improved, not improved. Crossover study designs. Randomized group 1, group 2 observed. Group 1, group 2 time for eliminations, carryover effects observed. Group 2 and group 1 randomized patients to different sequences of treatment, but all patients eventually get all treatment in varying order. Patients act as his or her own treatment groups, therapy A and therapy B. Crossover designs. Advantage and disadvantage of crossover type of randomized clinical trial study designs. Advantage. Influence of confounding factors is reduced because each crossover patient serves as his or own control. Patient assured that sometimes during the course of investigation they will receive the new therapy. Disadvantage. Not suitable if the drug cures the disease. Effective in certain stages of the disease or rapidly changing conditions. The issues of order affects. It is possible that the order in which treatment are administered may affect the outcome. Factorial study designs. Factorial trial assign patients to more than one treatment comparison group. These are randomized in one trial at the same time. While drug A is being tested against placebo, patients are re-randomized to drug B or placebo, making 4 possible treatment combinations in total. Studied effect of BP lowering medications, ACEI, on MACE and effect of vitamin E in cancer prevention in or older patients aged greater than 60 years. Hope study. Subject randomized. Ramipril, placebo. Ramipril, vitamin E and placebo. Placebo, vitamin E and placebo. Factorial design used in study of ramipril and vitamin E. Ramipril. Both ramipril and vitamin E A. Ramipril only C, vitamin E only B. Neither ramipril nor vitamin E. Factorial design study. Studying the effects of ramipril, pink cells versus no ramipril. Both ramipril plus vitamin E, ramipril only, vitamin E only, neither ramipril nor vitamin E. Factorial design of the study of ramipril and vitamin E and 2 multiply 2 tables, ramipril, both ramipril and vitamin E A. Ramipril only. Vitamin E only. B. Neither ramipril nor vitamin E. D. Factorial design studying the effect of vitamin E versus no vitamin E. AB versus CD. Advantage: two trials for almost the price of one. Design is best if two interventions have different mechanisms of action or different outcomes. Disadvantage: need to test for possibility of interventions. A differs based on the presence of absence of. B. Need to consider a gain in cost versus increased complexity. Recruitment and adherence issues. Potential for adverse effects. Cluster randomized trials performed when larger groups, patients of a single practitioners or hospitals are randomized instead of individual patients. In a rural area with an endemic disease, we might randomize whole village to have the interventions or not, rather than individual patients. To evaluate health system interventions, educational intervention in school for prevention of CV risk factors, to avoid treatment group contamination, administrative convenience. Randomized clinical trials can also be described on the basis of hypothesis. Superiority studies, equivalent studies, non-inferiority studies. A superiority study aims to show that a new drug is more effective than the comparative drug, placebo, or current best treatment. Equivalent study is designed to prove that two drugs have the same clinical benefits. A non-inferiority drug aims to show that the effect of a new drug cannot be said to be significantly weaker than that of the current treatment. Thank you very much.